So when you think about advocacy, advocacy is essentially the act of, I want to advocate. It's the act of acting on someone else's behalf or on a community's behalf to make change of any kind, right? Whether that's a policy change or whether that is you as a patient with your provider advocating for or sharing your experiences, and how can you and the provider work together. And also individuals as patients. And what really struck me yesterday was the number of young people we have here, and a lot of folks who are under the age of 18 who will soon be bona fide adults, and how will you advocate for yourself? So we're gonna have a sort of a full circle conversation, so we'll get into it. I think one of the things that I think would be really important for the young folks in the audience is that when we were growing up, there wasn't an internet. So in case you didn't know, it wasn't around forever. And today's Saturday, so Saturday mornings were like the day that you got to wake up early and go watch television, because there would be cartoons. Like, there was no Nickelodeon, there was no Cartoon Network. This was like, you had like 4 channels, and one of them, was the one that you got to watch. So woke up every Saturday morning, like super excited to go downstairs and watch my morning cartoons. And the way most of us learned our grammar, whether it was adverbs, nouns, articles, or all of these things, was actually through this series called Schoolhouse Rock. So I thought we would start by showing all of you how I learned about how the federal government works. Now I'm the chief patient advocate, which means my whole job is to work with the federal government on behalf of this community and many others. So let's start with, again, a little bit of a civics lesson.
Whew. You sure gotta climb a lot of steps to get to this Capitol building here in Washington. Well, I wonder who that sad little scrap of paper is.
I'm just a bill, yes, I'm only a bill, and I'm sitting here on Capitol Hill. Well, it's a long, long journey to the capital city. It's a long, long wait while I'm sitting in committee, but I know I'll be a law someday. At least I hope and pray that I will, but today I am still just a bill.
Gee, Bill, you certainly have a lot of patience and courage.
Well, I got this far. When I started, I wasn't even a bill. I was just an idea. Some folks back home decided they wanted a law passed, so they called their local congressman, and he said, "You're right, there ought to be a law." Then he sat down and wrote me out and introduced me to Congress, and I became a bill. And I'll remain a bill until they decide to make me a law. I'm just a bill, yes, I'm only a bill, and I got as far as Capitol Hill. Well, now I'm stuck in committee, and I'll sit here and wait while a few key congressmen discuss and debate whether they should let me be a law. I hope and pray that they will, but today I am still just a bill.
Listen to those congressmen arguing. Is all that discussion and debate about you?
Yeah, I'm one of the lucky ones. Most bills never even get this far. I hope they decide to report on me favorably, otherwise I may die.
Die?
Yeah, die in committee. Oh, but it looks like I'm gonna live. Now I go to the House of Representatives and they vote on me.
If they vote yes, what happens?
Then I go to the Senate and the whole thing starts all over again.
Oh, no.
Oh, yes. I'm just a bill, yes, I'm only a bill, and if they vote for me on Capitol Hill, well, then I'm off to the White House where I'll wait in a line with a lot of other bills for the president to sign, and if he signs me, then I'll be a law. How I hope and pray that he will, but today I am still just a bill.
You mean even if the whole Congress says you should be a law, the president can still say no?
Yes, that's called a veto. If the president vetoes me, I have to go back to Congress and they vote on me again, and by that time you're so
By
old.
that time, it's very unlikely that you become a law. It's not easy to become a law, is it?
No, but how I hope and pray that that I will, but today I am still just a bill.
He signed your bill, now you're a law.
Oh, yes!
I love that video. So I guarantee that anybody in this audience, I was born in 1971, anybody who's around that time frame was singing along with it like I was, but you weren't mic'd, so you could probably sing out loud. I just wanted to be careful that you weren't exposed to my voice. So again, that's a very simplified version of how federal policy legislation is created. But really, each of you has, so let me back up for 1 second. I should say that video was developed in 1974. So the reference to he, congressman, I realize that things have definitely evolved, and maybe Schoolhouse Rock will issue an updated version, but I just wanted to acknowledge that for folks in the audience that it was created in a very different time. But each of you really has the opportunity, whether it's by writing to your member of Congress, going to Capitol Hill with different coalitions that I know the NF community brings together, and really that is policy advocacy. And we'll circle back to that. But I want to start by talking about advocacy in the context of advocating for patients. And we're going to start with sort of the provider perspective, since we have Dr. Lewis Hall here. And then as we discuss a little bit more, we'll talk about your advocacy as a family member and all of those things. But, talk to the audience a little bit about sort of how did you decide to become a physician, and was advocating for the patient part of that decision?
Absolutely. I've wanted to be a doctor since I was 6. And the impetus for that was my father's brother, 1 year younger, was a paraplegic at the hands of a polio infection when he was 6 years old. And so he moved in with us when I was born. And so I grew up seeing my parents take care of him, me taking care of him, and then falling in love with the healthcare providers that were providing care to him, the surgeon who fused his spine so he could continue to walk on crutches, the primary care physician that dealt with all of the other symptoms and issues that arise in someone that's paralyzed, and on and on and on. And, I just couldn't imagine being anything else or doing anything else. So seeing advocacy at work and understanding kind of the role of the patient, the family, and the entire healthcare community working together was an inspiration.
Mm-hmm. How has it evolved over time?
Well, I have to admit it was a rude awakening when I actually came into healthcare. I had grown up with this starry-eyed notion of everything that's all, is all wonderful, and people were devoted and they were thorough and they talked to each other, so they were aligned and all of that stuff. And then I got into healthcare and realized that a lot of people had no access to information, no access to treatment, no treatments to have access to, and that there wasn't the kind of coordination that I had been witness to when I was a little girl. And so there was a new kind of advocacy for me, which was, how do you work within the healthcare industry or community to shape in response to the needs of the people who are there. And I used to get a lot of feedback. My patients would say, would teach me amazing lessons because I would be telling them very scientific and things that I thought were very important and all of that. And I would get a lot of down-home wisdom from people on the front lines. So my patients were my best teachers about advocacy and about what to advocate for, because that's often the problem.
Yeah, I was so inspired this morning seeing, and I'm terrible with names, but the Clinician of the Year award, and thinking about how much you've advocated for patients over decades. And when I was growing up, I too wanted to be a physician, and I majored in science, political science, because that's real science. That's a joke, laugh. and kind of had a circuitous route to getting into medicine and working in the industry. But I worked in a pediatric practice through college, and it's interesting because you see all different kinds of folks, right? Different kinds of practitioners, but I was always really impressed, especially with pediatricians, that they're always advocating for the patient or advocating, and sometimes it's a struggle. We're seeing, a lot of advocacy is necessary in today's environment that maybe wasn't before around vaccines and some challenges, certainly. But what I'm hearing you say is that the physician didn't always know everything.
Yes, surprisingly.
Wow.
Because we often thought we did. But I'll give you an example of how I was led into some advocacy at certain points. If you think about diversity in clinical trials, just as an example, I had a patient when I was a medical student, and she was an 80-year-old African-American woman. And I had read all of the data on the disease that she had, the medications that were used, the dosing, the side effects, and all of that information. And I was being very confident about my knowledge in this. And so I was sharing it. And then this happened, and then that happened, and this only happened in this percent of people. And she reached across the table and touched my hand. She said, "Baby, if it happens to me, it's 100%.
Yeah.
And it dawned on me that she would not have been in not one of the studies that I was referring to. That she would have probably been excused or excluded from the study because of her age. Women in clinical trials was not necessarily a thing
until
back in the
1993.
70s. Exactly.
Yeah.
So these were things that I had taken for granted from the data science perspective that I realized were not in her service at all. And so it's those moments that patients tell you or family members tell you, I appreciate your advocacy, I appreciate your information, but here's what I think I need. And so let's work together to figure out what I need. And then there's some of it that I can do to help make it so. There's some of it that you can do to help make it so, but together there's a lot of it that we can make it so. Yeah. So being sure that you're aligned about what you actually want as an outcome, as aligned across all of those affected. And I think that's one of the opportunities that I've seen you from an NF perspective pursue, that when I hear about your wins and your progress, I realized that it wasn't one person who had a great idea. It was the input of many people, the synthesis of those ideas, the alignment of it, and then all hands on deck to make it happen.
Yeah. So I'm gonna issue a notification now that I'll be talking to Dr. Lewis Hall about a couple of other things, but I really am going to turn things to the audience. Ask anyone who's a clinician in the audience to talk about, come up to a mic and share about a time that you advocated for a patient or a patient educated you. You don't have to necessarily be in the NF space. I know there are lots of clinicians out there. And then what we're going to do is I'm going to turn it to the families and really ask you to share your stories of advocating on behalf of folks in your family. But just to warm things up, in case we don't have a lot of volunteers right away, I'm going to ask Dr. Lewis Hall, if you don't mind, to talk a little bit about how your role as an advocate has changed a bit over the last couple of years in particular, and how that has shaped your thinking as a physician.
So I think two things have happened. One is I spent a lot of time advocating what I'll call inside, trying to change the drug development paradigm, trying to increase inclusion, if there are ways that we can crunch, if you would, the cost, the time, et cetera, as we're doing this. So I spent a lot of time thinking about in where I am right now in the industry, are there things that I can do from from a rule or law standpoint, from a practice standpoint, are there changes that would be helpful that I could help facilitate and advocate for? And then lately, I have found myself more one foot inside the community of drug development, diagnostics development, et cetera, and another foot in the space of really understanding what I'm advocating for from the patient's perspective. And I like to think that I was doing a really good job of that all along, but I've realized recently that there's much more that we can do to pull. What are your questions? What are your needs? What are the subtle differences that you as an individual are experiencing that may be addressed, as opposed to the groupthink that we also that we often also do when we're thinking about a group of people. So all depression isn't the same. All NF is not the same. Every need of every family in every state is not the same. So beginning to understand the subtleties to drive advocacy has really hit home for me in a very different way in the last decade or so.
Yeah, I think, and so I shared a little bit about this yesterday, that for those of you who didn't read her biographical sketch, Dr. Lewis Hall is like the Oprah of like medicine. She's really well known. But I am fortunate enough that she's been a mentor for me and really helped me advance in my career. So for me, this is a really personal discussion. We have spent many Saturday mornings just chatting, and I've appreciated you sharing about your grandson, African American, growing up or living out in LA, and the considerations you have to make around, if you get a speeding ticket. I mean, things that just in today's world, you've just been, I don't know, just like you're like my favorite aunt, and so I just wanted to share that, and I want you all to think of her in the same way. And then you can go on YouTube and watch all her episodes with Dr. Phil and being on TV and all that stuff. But, I think what I'd like to sort of see, are there folks in the audience, anybody who wants to talk a little bit about sort of an advocacy experience on behalf of your patient, or maybe a time when you thought maybe you would have advocated differently? Is there anybody who wants to share anything like that? I think,
well, can I add, let me add one thing, because we did the bill from an advocacy standpoint, but there's so many other places that can as directly drive. So there are input valves, if you would, for the National Institutes of Health, for example, work in biomarkers and diagnostics and developing treatments. There's an opportunity now in rare disease focus at the FDA, where they realize that every kind of rule number one has an A, B, C, and D that needs to be subtly different in order to address the needs in different therapeutic areas or for different diseases. So I think that there's the big capital A advocacy from a bill to a law standpoint. But there are other points of advocacy that can become important, and they can either kind of drift up for greater inclusion, or they can focus in on more specific adaptation to be sure that in the uniqueness of the disease, the person's individual circumstances, as much as we can focus on that and accommodate it in the kind of rules that have been written, the processes that have been established.
So I'll turn a little bit more to be sort of open things up a bit more, and that is what I've been so impressed. This is my first time attending Summit, and it's amazing. The energy here and the community is incredible. I met a family yesterday. Both parents are physicians, and their daughter had gone to a summer camp and still stays in touch with folks like on Zoom every single week. And it's like, this is an incredible community and NF related summer camp. So are there parents out there who want to either ask a question and I won't have the answer, but somebody in the room will, or share an advocacy story again of a journey that you really had to work toward, or a challenge, or a wonderful story on advocating on behalf of your family. And if you don't mind, you can share your first name and your sort of connection to the community.
I'll get things started. My name's Lydia. I live in Colorado. I have a 22-year-old with NF1, and he has a related condition called moya, which is abnormal vascularization of the brain. So he gets annual brain MRIs. And even though we're in this amazing children's hospital at Colorado, every time he'd go in for an MRI, this was a while ago, right? This is when he was younger, so 15 years ago, but they'd open up the paper file and look at stuff, and I was talking to anesthesiologists and waiting for them to say, we'll keep an eye on his blood pressure, but it wasn't said, so it was the onus was on me as a parent to do that. And I thought, oh my God, I can't believe they can't get this right. I mean, but it's old-fashioned paper. Now things have gone electronically, but I brought this up to the attention of the stroke doctor that we were seeing, and he took it upon himself to go, hospital-wide. So this is not governmental advocacy, but just internally within just the hospital, to change that system so immediately anybody with NF, anybody with moya, immediately a red line comes up. These are things you need to keep out. Every time he comes in the hospital, the doctors immediately see that as an identifier, whereas before they'd have to go through piles of paper to figure that out. So that's just one personal experience that I thought I'd share with other people. To encourage you all to speak up, even if it feels scary internally, because it can trigger change for a lot of people, not just NF patients, but all patients.
Yeah, and think of the impact you've had on NF families. Everybody going to this hospital now has they can trust that there's a protocol in place, and that your stroke doctor advocated for you. So, kudos to you. That's amazing.
So my question for you is, he's now 22, and adulting is hard, as we've talked about a few times already, but from a parent's perspective, it's particularly hard. As soon as that child turns 18, immediately you're cut off from easy access to medical information and guiding your child, young adult, into adulthood. And so much of NF is, like I said, has over even the last decade has evolved so much. There's so much information at this symposium versus the last one I attended when he was probably 8 years old. And my frustration is, how do we guide our young adults to manage their process and be on top of all these things that are happening? It's really, I guess, scary for a parent of a young adult to really understand what pathway to put them on and how we can better advocate for some better scaffolding, especially as they become adults. Thank you.
Yeah, it's a really insightful question. What are folks in the room thinking about? Are there parents here who've been through that journey, or young adults who want to share their experience through that journey and offer some advice and support? Folks have their hands up. Oh, great, over here. Oh, we'll wait till you get a mic.
What I was going to say is actually very closely tied to that, so I guess I'll take my turn to speak. Hello, my name is Kylie, and I am an NF patient, and everything that I learned about sorry, I'm trying not to get emotional.
It's okay.
Everything that I learned about self-advocacy came from my amazing mom, who's been my caregiver my whole life, and I'm very fortunate to have her here with me today.
Love you, Mom.
I think one of the hardest things that not only I had to face, but also her being my support system, is the fact that not only do I have NF, but so does my brother. And we inherited it from our father, who unfortunately passed away when we were very young from cancer. So we were not only navigating a world where, at the time in my childhood, there was very little information understood about NF and the possible treatments, but she was looking at all this from the outside. She had to step into this world of something she didn't understand, something that she wanted to find these answers for so desperately, and wasn't always in a position to know where to look, how to find it. But she taught me through her own journey and lessons that she instilled in me very directly. We need to be loud. We need to be heard. Doctors know so much, but sometimes you have to know how to ask the right questions, and you need to not be afraid to go in there and say, maybe I'm completely off kilter here, but what about this? What about that? The treatment that I'm currently on, we only found out about because she was watching some Sunday morning broadcast and called me in complete, I want to say happy hysterics while I was in college, saying, we need to look into this right now, because she kept asking questions and encouraging me to do the same. And it's been, as most of us will say, probably one of the wildest journeys that will never end, trying to get to a point where we can continue living and proud of everything we've done, and continue living a life that we're happy to be in, because we deserve that, and it doesn't happen unless you ask those questions. And I'm going to be 25 next month, and I'm still calling her up saying, hey, what do you think of this? What do you think of that? Mm-hmm. Aging out doesn't mean being on your own. Becoming an adult doesn't mean you lose your support system. It just means that it's there for you in a different way. It's not making your decisions, but they're guiding you and holding your hand when you need it. So my mom taught me that. I'm very grateful.
Let's go back and forth with your mics. There.
Hello? Oh.
Hi.
Good morning. I'm looking at the screen. You over here. I'm sorry.
I can't look at the screen. I can't deal with myself on camera. Sorry.
I'm going a little off track here, but in reference to the question you were talking about, when you were talking about things you've seen on TV, I can go back even further than you. I can remember my morning show was Three Stooges, so that was a little different. But when you talk about advocacy, what I learned with my daughter and her mother, who was there in the forefront when we found out about this, because quite honestly, I'm sure I'm not the only one that found out. When you started talking about NF, I always remember when my daughter was a little girl, they would have, what you guys call it, the ground rounds, where all the doctors would come in to look at her. And I didn't quite understand what that was about, because when they talked about NF, most doctors didn't really know much, from what I think, but every now and then we'd find somebody that knew something. Long story short, when we got to, Angela got to be about, maybe 7 or 8. Can't remember. When I was talking to Dr. Hall about this yesterday, she went to the NIH. Some doctor had guided us to that, said, well, maybe you should go down there. They have research, because they did not have any answers. And just like some of the younger mothers and fathers that I'm hearing now, I've been doing this now for 34 years. There was no answer. They would tell you, well, you'd ask those questions, and they would say, we have to wait and see to puberty, and my daughter's like 7 years old, and I'm thinking, why I gotta worry about that? But long story short, we ended up going to, and this comes back to the advocacy thing, and she ended up in a trial for, I forget, you know the medicine I'm talking about, Dr. Hall, the Gomaclin?
Gomaclin. Mm-hmm.
Yes. She was one of the original people in the trial when she was 8 to 12. And she did that for years, and go back every year back with the thing we talk about, phase 1 and 2. Fast forward about 20, 30 years, and then later, when it became an actual medication, she filed to get a grant because the medication was very expensive. And now she's taking the medication, and her tumor has shrunk tremendously. So by her getting out there and helping in the beginning, she's the beneficiary. That's all I want to say.
Thank you so much for sharing that. Right, go this side of the room.
Hi, my name is Kim, and we're from Ohio. I think I agree 100% about the mom and transitioning. We're there. He's turned 18, and in the world of medicine, you turn 18 and he's gonna solve all his problems that have been happening his whole life, all on his own, and manage all of his friends and his care team. And I'm gonna be standing outside hoping and praying that it all works out really well. And that really doesn't happen because they're very overwhelmed. We're overwhelmed as parents and adults managing their care through their lifetime. So what I learned was to give your child a voice early on. Start it at 8. You know, started before that about how they feel when the doctor walks in the room and they start asking you questions. If your child can manage it with your encouragement, have them answer those questions. You're asking me how he's feeling, ask him how he's feeling. Ask him what he thinks. You know, as soon as they can verbalize it, you know, we talk to our kids about their feelings, we talk to them about all these things. Have them utilize it in that space. Also teach them not to be afraid of their medical team because they can work in a collaborative way together. So as they grow and they develop, they become more comfortable asking those questions way before they turn into adulthood. So they've established that in their relationship with their physicians. And he would say to me, what does Dr. Weiss think? What does he think? And we were blessed to have him for 13 years, which doesn't really happen very often in your clinics. But he would ask me, and I would say, this is what we're talking about. And you establish that, but you really get that rooted with them. Do I still help him navigate everything? 100%. I mean, you know, he's got 7 to 10 doctors at home and in his clinic. So, but we manage it together. So little by little, I started stepping back. Even like here, I've stepped back a lot more, and he's advocating more for himself, and he's sharing his story. Eventually, those kids, it becomes their story, and it becomes their advocacy and their voices. So we start that at a young age, especially with the medical field.
Do you mind sharing a little bit, I think just to come full circle to answer, I think Holly, what was the legal process so that you could continue to support the navigation? What did you have to do in order to see records after your child turned 18?
He had to sign paperwork. So the first thing we did was before he turned 18, I talked to his neuro-oncologist. And the 2 big questions was, how long can we stay at the children's hospital? So he sees a regular PCP and all the friends at home, right? But this clinic they're on the forefront. I mean, they worked hard with NIH and all of the things. And so how long can he stay? In his department, he can stay forever. Like surgically and all the other things, he would have to go to a grown-up hospital, you know, regular hospital. But within his care team, he can stay at, we go to Cincinnati Children's, he can stay there as long as they let him. And he wants to. Because as we also know, there's not a ton of clinics and a ton of things set up for adults. So the fear of leaving your security is huge. And having the same level of care and insight that you have within the pediatric world. So that was the first question I had. And the next question was, we were concerned about, he's like, I need my mom to see my chart. Because up until then, I could see my chart and I would get all the information, and then all of a sudden, boom, you're done. And actually that happened at 14. At 14, he had to give me permission to have access to my chart. And then once again at 18, he had to give me permission. So it's a whole thing. And it's very alarming at first. I was like, at 14, I was shut off. And I was like, what? He's 14. And here's the thing, I'm still carrying his insurance till he's 26. So I'm like, but I have nothing. So those were the questions, and his doctor steered us in the right direction. You know, if you have major concerns, there's patient advocates and there's also social work that will help you navigate those things too within the realm of the department you're in the hospital. And don't be afraid to ask. That's the biggest thing, is go in with your questions before you get there, because they have a limited amount of time, but you're not leaving until you answer my questions, because that's just how it is. And I drove 2 hours, and we're here, and like I told the one doctor, I said, listen, I appreciate you and your knowledge base. To you, he's patient 1,185. To me, he's my number 1. So here are my questions. And I just need answers the best that you can. And if you don't have them, then we need to figure out how we're going to get them. And I think when you go in with a plan, your physicians respect you as a parent, and they know that you're not going to go rogue and you're not this crazy parent, and you're like, oh, you have a plan, and they will work with you. And if you don't, then you need to find the ones that do, because this is your life, your child, this is it. So, and like I told him, I said, God, I hope when I prayed, I made really good decisions as you were growing up. And if I didn't, I'm sorry. But I did the best I could with the knowledge that I had at the time. And as parents, we have to remember that. We're doing the best we can with what we have.
Thanks so much for sharing that.
Hi. To the mom that has a son with moya moya, my son has moya moya and my daughter has NF also, so all three of us have it, and they're both adults, and the form that we filled out was medical power of attorney, so that I can legally talk to their doctors with them there or without them there and make their appointments, and they both signed that at 18. So that I could help them. And I think that getting that form signed, the kid can revoke they're adults, but they're my kids, can revoke it at any time if they feel like you're overstepping. But I think that it is a good form to fill out. You have to have it notarized, and then you just share it with doctors, and it's a legal document that helps you have access to your kids' medical, including insurance, everything that medically that they need. So it's a medical power of attorney. You can print it online and have it notarized and share it with your kids, your adult children's doctors.
That's great advice. Thank you for sharing that with everyone.
Testing.
Oh, there we go. My name is Vincent Coe. I am a newer NF1 parent, so just getting up to speed. But I wanted to share a story about advocacy from another disease. So I am a father to a daughter with congenital kidney disease, and I run another patient foundation. And so it all started with me asking why there were not enough therapies in pediatrics for congenital kidney disease. And at first I was scared, but every single time I was scared, I would just look at my phone and remember my why. I think everyone in this room has their why. For a lot of people, it's children. And so I just started knocking on doors, started with the low-level doctors, not low, like local doctors, then national doctors, eventually NIH and FDA, just kept on knocking on doors and asking why there weren't therapies. And along that way, built allies. And eventually that culminated in all those stakeholders for 2 days at the FDA working on therapies for hopefully my daughter and families like mine. And so just not taking no for an answer. But I guess my question would be, how can NF1 families participate in that advocacy at that high level? Obviously we have, huge quarterbacks like Annette, banging on doors too, but how can we support her and make sure that we are there at that like top level, A level, FDA, NIH advocacy level?
Well, I think that the question is answered in many ways, but I'll start with the first thing is finding out what you need and what you want advocated for. Again, I think that one of the big challenges in advocacy is getting an agreement on what we're trying to get done by when and why. So I think one is providing your feedback to the organization that, these are critical issues. Perhaps they're not as high on the priority list. Is there a way to get those pushed up? Is one of the ways to get those pushed up by having additional participation from a group that is especially focused on this one issue or effort. And I know that NF has a lot of powerhouses that are on the ground doing the work every day. But I think one of the big opportunities is then to be sure that I don't want to use the word volunteer, although I know everyone volunteers, to make yourself available and make it known that you are available, especially around one or two issues, or to essentially raise your hand. I saw Annette, nodding, and others, let us know that you're here. If you have a particular interest, what is that? If you're looking to define a particular interest, like what the greatest need might be, then, that's another part of the conversation. And I think there's a great opportunity. And can I use the conversation? Thanks to everybody for sharing your incredible stories. One of the challenges in aging up is that you're also aging out. And no one wants that to be the case, right? Young people have had the support of their family and medical team, and the fact that they're aging out of the pediatric space and into the adult space, and that their parents no longer have access to their records and they have to give permissions and all of that stuff. But I was sitting here thinking, I don't think I've ever seen material that says, this is what you're going to face when your child turns a certain age. These are the documents you're likely to have to sign. These are the challenges that you're going to meet when your child reaches this age and then that age and then the other age. Here are the questions that you should ask as that time approaches, so that you know if there's any uniqueness in the system that you're in that you need to deal with, and what are some of the general things. And I was sitting here thinking, have I ever seen that?
Does CTF have any resources to that end that you know of?
Not specifically to that. We do have a number of guidelines.
But I think we've just advocated.
And we have Kate helps, honestly. So when people reach out and have those challenges, we direct them to Kate, who gives them advice. But that's actually a really good idea. Very
so I was just sitting here,
sorry, what am I missing?
And I don't know that that's the direct answer. It's not the direct answer to your question, but just sitting here in the room together, hearing the challenges and how they've been met, and then pausing for a second and asking ourselves, what needs to be done to make that smoother, better, easier for families that are going to face that? How do we, exactly.
So can I ask a quick question? So first of all, yes, we're collaborating with the NF Collective, actually, which is another group of many NF organizations that came together, and we're part of that as well, on transitioning into adult. So I don't know exactly if these things that you guys mentioned are in there, but it's definitely part of that program. Here's my question. Is there an organization, because as you guys know, I love copying what other people are doing well. Is there an organization that you guys are aware of that has done this really well, that we could call up and say, can we replace your disease by neurofibromatosis and schwannomatosis?
I do have a couple of examples, but first I do want to answer your question about engaging at the highest levels. Most of the institutes within the National Institutes of Health have some kind of a stakeholder engagement process. So NIDDK has one, NINDS has a really robust one. So you can look online for the stakeholder engagement office, or reach out to the information desk. I'll give you my card, you can ask me, and I'm happy to try to connect you. But each of the institutes does have this. And they started, actually, NIMH was the first institute to have it, the mental health community, and that's where I worked for many years, as did Dr. Lewis Hall. And that really, that's become a quarterly event, and I know that may sound like really formulaic, but it is an opportunity. So we can talk offline about that if that's helpful.
Awesome, thank you.
Yeah, and then going back to the aging up question, years ago ACAP had that. Yeah. American Academy of Child and Adolescent Psychiatry. I don't know if they still do, but if someone can make that note so that I can follow up on that, I will. I don't know how to do that on my iPad.
But I'll just say, for me, as I sat here and listened to you, I was trying to think of who had done this exceptionally well. And I think there may be some things out there, but this may be a space, not just from an NF community perspective, but this may really answer a question for a lot of families that are likely to face this across a spectrum of diseases.
Yeah. And I will add also, and this is exactly why we hold this event, to hear this feedback, to help us develop these materials. We do have, if you go to our website, ctf.org/education, we do have materials for the lead up, including some transition documents. What I also wanted to say was that we have actually done FDA listening sessions. So we do have interactivity at the FDA, at the NIH, and that meets regularly with the folks at the NIH and others on our panels as well. So if you have ideas, bring them to us. We'll certainly make sure we're there, and we bring you there. So that's the way to go.
Hi, my name is Amanda Orth. I am a parent to Audrey Orth, who is 5 years old with NF1. And something I wanted to bring up in terms of advocacy is advocating for us as parents and caregivers. So being a parent and a caregiver is hard regardless of what you're going through. I went through my own mental health journey a few years ago, learning how to cope with my daughter's diagnosis and not blame myself. So I really just wanted to take a moment and acknowledge all of us for all that we're doing to take care of our kids, whoever it is in our lives, and just make sure that you are getting the resources and the help that you need to, because it's very important for us as the parents and caregivers to take care of us so we can take care of our kids.
That's such an important reminder.
And it's a notorious challenge for caregivers that are have often taken an unselfish stand. So everything they do is about the person that they're caring for or the people that they're caring for, and they're not dealing with their own opportunities for self-care, whether it's, you know, just a day-to-day, do I get a chance to take a walk to stay healthy, or you know, I'm just kind of eating anything because who's got time to figure out my nutritional needs when I'm dealing with someone else's. So I think this is a huge opportunity because I'm a caregiver myself. My husband has a very serious illness and disability, and I'm always, you know, checking my phone and thinking about what should happen. And true story, we were in our doctor's office, and he was looking at me, but he was talking to my husband. He was saying, yeah, we really need to get her to start taking care of herself. And they were talking to each other. I was like, hello, I'm sitting right here. And they just completely ignored me and were talking to each other about how I wasn't doing all the things that I needed to do to take care of myself. And they really needed to address that, since apparently I wasn't going to, you know, that kind of thing. So I think we're notorious as caregivers for not taking care of ourselves because we have a first priority that is not us. But we all also know that you can't give care if, you know, you yourself are not in the shape to do so. So, and I know that the caregiving discussions here are strong, and the support is good. So it sounds like you're in the right place, and your story is very meaningful for inspiring others to take care of themselves so they can take care of those.
And courageous. I mean, so thank you for like sharing that. And I would if you aren't familiar with the term respite, get familiar with it. There are many nonprofit organizations around the country. You can go to the National Alliance for Caregiving at caregiving.org, and they have a list of regional and local caregiving organizations, many of which do support respite care, whether that is through volunteer services. There was a foundation actually exhibiting here, and I don't know if they're still here. I got a hat from them. They have financial assistance for like family vacations and things like that. Again, so definitely, it's super easy to say, take care of yourself first. But the thing that always comes to mind, I always think about, like, you know, when you're on the airplane and it's like, put your mask on before helping others. And then the kid is like there, like not breathing and whatever. And you're just like, but you have to do that. You have to like put your mask on first. And so thank you for being courageous and sharing your story with us. It's really much appreciated.
Thank you.
And I do have to wish Dr. Listernick and his team were the first ones to identify that I was in need of some assistance. So I just want to thank Dr. Listernick and everyone at Lurie's for recognizing that and helping me out.
Hey, I'm Miranda McManus. I'm a patient advocate, and I'm also a molecular geneticist, so I kind of have my feet in both worlds. And I wanted to speak to what other people said. So talking about the transition, there are places that are doing it better than others. So for CTF, seek out the clinics. And NF Midwest, I think, has done a good bit with this, working with the NF Collective as well. So definitely try to reach out to those in the local community, pull for that, and it needs to start early, right? Think at 12, not at 16, because there's a process and you've got to start getting your child equipped for that as well. But other than that, as far as getting involved, and this is to everybody in the room, to Vincent's, there is a place for you with whatever you're comfortable with. You just have to talk to people. If you see a presentation and it's interesting and you want to know how you can help, ask. If there's not a place, try to make a place. CTF is great about helping you make a place. There's other NF organizations that are great at that. Just be willing to speak, and that's all it takes. There's stuff at every level. At the highest levels, they mentioned FDA listening sessions. I've done those. We've got an organization, RAINS, that works on clinical trial endpoints, and FDA people are at the meeting. You go on those listening sessions, look at who comes to the calls and who is interested, and look up their email. It's out there. There are ways to get involved. You just have to want to do it. And the way that you figure out what you want to do is by talking to the people around you. That's it.
Thanks for sharing that.
Hello, my name's Helene. I'm a first timer here at the event. I am from Colorado. I have a daughter who has NF, who's fully grown. I did not find out I had NF until I was 18 and I went to join the military, and a doctor found that I had NF. And back when I was 18, nobody ever heard of it. My own pediatrician who I saw till I was 18 never saw that I had NF. And now I'm my own self-advocate. As I moved into Colorado, I've been here 6 years, seeing the same regular doctor, followed me with NF, and I was like, I need to research this more. I need someone to look more into depth with me. And it took 2 years for me to get into a clinic here in Aurora. So now that I'm in this clinic, they said, you're in here now, you'll be in here for good. So I've had to self-advocate for myself for 4 years just to be able to be seen at the neurology oncology clinic.
Well, congratulations on that, because the tenacity and the bravery that it requires to just keep pounding on a system that is often unresponsive is really important, and is a model, because in many cases, unless you're pounding, well, maybe not pounding on the door, knocking down the door is sometimes the way to go. One of the things that you're bringing up that I've heard way too many times over the last couple of days is the delay in diagnosis. And we're talking a lot about treatment here, and what is the cure, what is the treatment, and researching that. But one of the questions is, what can we do to improve the diagnosis? Do you have to have access to a specialty clinic and have the kind of courage that you displayed in, pushing until you got your answer? Or is there something that we could do to make the recognition and the diagnosis, I hate to use the word easier, but more accessible and to occur on a more regular basis? And that if there's anyone that has been kind of thinking about the diagnostic end of it and thinking about how to speed it, I would love to talk to you about what you have seen, what may be on the horizon, and if there's anything we might be able to do to facilitate.
Yeah, actually, I think that's a really important point, Frida, so I'm jumping in line just to quickly share that there's been some really important work that CTF has helped to lead, but really through the leadership and brilliance of clinicians in the community, to update and think deeply about the diagnostic process. And also, just a few years ago, there was some changes that were made to improve that process and the understanding of it. But I'll also say that just at our NF conference a week ago here in Denver, listened to a great talk from one of our clinicians talking about the complexities, in this case specifically, of diagnosing non-NF2 schwannomatosis. And so it's an ongoing work, because even the clinicians in the room hearing that talk were like, oh my gosh, like, so it's an ongoing commitment from our clinical community to really understand not only how to make these appropriate diagnoses, but then to disseminate that beyond the specialty centers out into the community healthcare systems where, I know when I was a nurse in an NF clinic, I did training with the nurse residents every single year to tell them all about NF, because sometimes it's a nurse who notices this kid's got a lot of birthmarks, but they're here because, they have, rotavirus, or they're in the hospital for something else. So yeah, I just wanted to say absolutely a round of applause for the commitment to advocating for yourself.
And hopefully you'll connect with other folks here. As a first timer, I hope you do connect with other folks here.
We're going to make this the last question.
Yep.
Because we're almost at time, and hopefully some closing. Sorry. Cut you off. Were you saying something?
I am Steve Sheard. I know a fair number of you. I am one of 9 people in my family with NF, in the middle generation, also not diagnosed until I was in my 30s. My daughter was the first diagnosed. On this journey managing NF, we have to learn a lot about self-advocacy, and my own journey led to my becoming a board-certified patient advocate, and I am currently an NF patient navigator at Massachusetts General Hospital, working on the My NF Guide project, and also staff at Brainy Ridge, where we run a summer camp program for kids with NF. And one of the things we've seen is what you were talking about, is that navigating the transition from pediatric to adult care is a huge problem, and it's a huge challenge. And there are some excellent resources available now. And in fact, we received a grant from SpringWorks to work on this. And so if you are interested in resources, please feel free to stop by our table. We have the model for how to do a transition in care available, drawn heavily from Got Transitions, which, if you're not familiar with that, is available free on the internet, and it's an excellent resource. NF Collective also has some very good material on this. And, it's the preparation for transition in care is a lot like learning to read. We can't hand an 18-year-old a college textbook and expect them to read it unless we taught them the alphabet. And that process really starts in childhood. And teaching children at a developmentally appropriate level what their condition is and how to start talking to their care team and opening their mouth and saying anything at all to the doctor to get them comfortable with speaking in their own voice is a vital part of that. And so if you're interested in resources, please feel free to stop by our table and see. We have some stuff available that might help you, and can certainly refer you to other resources.
Thanks so much for sharing that.
Absolutely.
So we'll close now, but again, coming full circle, we are all advocates. That's the title of our presentation or our discussion today. Not just policy advocacy, what we kicked off with, but we've heard from so many parents, people living with NF, and again, from you and your wisdom. So round of applause for all of you for being part of this discussion and for continuing to be such strong advocates.
And I just want to give a last compliment, which is one of the things I hear here is a lot of listening. So the sharing of the stories, I think, is very important. The sharing of your information, your wisdom, your access, and your advocacy is also very important. But the community that you have is novel. And Annette is also always asking, is there a really good model for this and a really good model for that we could learn from? And I want to congratulate you, because you were an amazing model of what building a community that is resourceful and productive and all of the everything. And just watching you all interact with each other has been an honor and a joy, and thank you for having me with you.
Yeah, a huge thank you. I completely agree with everything. And I just want to quickly say that this has been really inspiring for me as the person who's been planning this event for a long time. And what I'm noticing is that by having the two of you up here and just inviting people to share stories, to ask questions, I can see the learning, that's bouncing back and forth. And I actually had a staff member said, go get Stephen Sheard because they're asking about transition, and Stephen is a great resource. And so I love that, and it was wonderful. So thank you to both of you for leading this conversation. I really appreciate it. Yeah.